Hi everyone, welcome back to my YouTube channel. Today we are going to talk about dentigerous cyst. We will start our topic with the definition. A dentigerous cyst, also called as follicular cyst, is a benign developmental odontogenic cyst that forms around the crown of an unerupted or developing tooth. It is second most common type of odontogenic cyst, that is after the periapical cyst. That is most common type. Now we will talk about epidemiology of dentigerous cyst. We will talk about prevalence. Dentigerous cysts account for approximately 20 to 24% of all jaw cysts. Now, talking about age group, typically dentigerous cyst occurs between the ages of 10 and 30 years, though it can be seen in a wide age range. Talking about gender predominance in dentigerous cysts, slight male predominance has been reported in studies. Now we will talk about etiology and pathogenesis of dentigerous cyst. Dentigerous cysts develop from the accumulation of fluid between the reduced enamel epithelium, that is part of tooth follicle, and the crown of an unerupted teeth. This results in epithelium-lined cavities surrounding the crown, while the epithelium being derived from the reduced enamel epithelium. Now we will talk about the clinical feature of dentigerous cyst. Talking about the location of dentigerous cyst, it is most commonly associated with mandibular third molar, that are wisdom teeth or maxillary canine. It may also occur around other impacted or unerupted teeth, that may be supernumerary teeth. The symptoms of dentigerous cyst include: it is often asymptomatic and detected incidentally during routine radiographic examination. Larger cysts, if present, may show painless swelling, facial asymmetry, displacement of adjacent teeth, and delayed eruption of teeth. Now we will talk about radiographic appearance of dentigerous cyst. It appears as a well-defined unilocular radiolucency associated with the crown of an unerupted tooth. The cyst borders are typically corticated or well-defined, as you can see in the picture here. Now we will talk about histological features of dentigerous cyst. Histological features include epithelial lining and cyst wall. Epithelial lining is thin, non-keratinized stratified squamous epithelium. It may occasionally show mucous cell or ciliated cells in the lining. Then we can also see his chest wall of the dentigerous cyst, that is composed of connective tissue, and it may contain cholesterol clefts or area of chronic inflammation in long-standing cysts. Then inside we have a cystic fluid that has different components like debris, proteins, etc. And the important thing about dentigerous cyst is there is absence of inflammation. It is typically non-inflammatory unless secondarily infected. So most of the time it has absence of inflammation, or it is not associated with inflammation. Now we will talk about complication of dentigerous cyst. If left untreated, dentigerous cyst can lead to pathological fractures of the jaw because it keeps expanding, and when expands to a larger area, it can cause weakening of the bone, and as a result, it can cause fracture of the jaw. It can cause tooth displacement or resorption of adjacent root because of its expanding nature, and it can also cause, even though it is rare transformation, but it can also transform into odontogenic tumors such as ameloblastoma, squamous cell carcinoma, and mucoepidermoid carcinoma. Now we will talk about management and treatment of dentigerous cyst. Treatment options for dentigerous cyst are enucleation and marsupialization. Enucleation is complete surgical removal of cyst and associated tooth. It is most commonly performed procedure. Then we can also do marsupialization, that is alternative for large cysts to reduce their size before complex removal. Talking about the prognosis of dentigerous cysts have an excellent prognosis with appropriate treatment. Recurrence is rare but possible if not completely removed. Then in management and treatment, we also do follow-up as there is possibility of recurrence. So long-term radiographic monitoring to ensure resolution and check for any recurrence or complication is necessary in the treatment or management of dentigerous cyst. So this was all about dentigerous cyst. If you like our video, don't forget to like, share, subscribe and comment. Thank you so much for watching.